Welcome everyone to the Patient Voice Amplified podcast. I'm Adam Charrington.
And I'm Dan Check.
Thrilled to have our listeners join us again today for this next episode. Very happy to welcome Chaim Indig, the CEO of Phreesia, with us today. Chaim, welcome.
It's great to be here. Thanks for having me.
I'm
very excited.
It's our pleasure. Glad to have you here. And this episode's been a long time coming. We're very excited to welcome you and talk about our mutual project together. So as we've talked about this for a long time, Dan, we partnered with Phreesia and were able to interview almost 13,000 patients on a report we published a few months ago. And Chaim, we were just talking before the episode of how much this is being used already. I know it's something that Dan and I are talking about at least once or twice a day. It's coming up, this unique perspective.
Well, I just think it's really important that in healthcare, the voice of the patient is heard, right? So patients are at the center of what we do in healthcare for everyone in healthcare. And I think it's just great that we were able to get their voice heard and with a broad perspective across the country in all different demographics. So partnering with KLAS has been something we've done for years, and this is something we're proud of.
Well, as are we. We're very excited to dive in and talk about this. So, Chaim, why don't you give us an introduction about yourself and Phreesia, and then we'd love to kind of set up the details and scope of the report and how it happened and why it happened, and then we'll get into some of the particulars. But can you introduce yourself to our listeners?
Absolutely. So, as you said, I'm Chaim Indig. I'm the CEO of Phreesia. We're a SaaS company. I founded the company with our COO, Evan Roberts, back in 2005. I had an apartment in New York, and we've since grown tremendously. We're a product-led growth organization that really focuses on and keeps the needs of patients and providers as our North Star. Our mission is to create a better, more engaging healthcare experience for patients, providers, and staff. And we do that by improving many of the processes involved in the patient's healthcare journey, including by automating registration, giving patients flexible ways to pay, making it easier to schedule appointments, and helping patients to get the care they need. Last year, we facilitated more than 100 million patient visits across all 50 states and across every major specialty and care setting. And making sure patients get convenient, engaging healthcare experiences they want and prefer is core to what we do here at Phreesia.
Fantastic. That's great. Well, let's talk about the report a little bit. And Dan, do you want to give a little background how this came about?
Yeah, so a couple of years ago, KLAS did a study. It was just a quick and dirty study of patients. We reached out via social media, LinkedIn, Facebook, and we just had a couple of hundred patient responses and found some really insightful things in the data. And this left us with an appetite to know more, to get a deeper sample, to really understand a broad swath of patients, not just those that were already connected to us on social media. So we had this desire. We knew there was some disconnects in the industry between what patients wanted and what provider organizations were delivering and what vendor companies were developing. And we wanted to shine a light on that a little bit more. And so we were looking for partners that could help facilitate that data collection, that already had a connection to a lot of patients whose missions aligned with our mission. And that's what led us to talk to Phreesia.
I remember you guys shared that report that you did on Facebook with us during our executive session with KLAS. And the conversation was, we could do something way better together. We look at this data all the time in making decisions about product. And I think that it's and we had just started doing publishing research. We had just published all that, a lot of our groundbreaking reports with the Commonwealth Fund and Harvard on the impact of COVID had on ambulatory visits. And I think it sort of rose from the fact that the reports that we did there had just phenomenal feedback from the market. And providers really appreciated knowing what was happening in the market and what how the trends were moving and if they were different. So yeah, I do remember that very vividly. That executive session was really interesting.
Well, the synergy's been really powerful, and appreciate your team and the partnership. Chaim, why don't we dive into the report a little bit? What are some of your general reactions to what you saw in our report?
So 86% of patients who we surveyed said they were comfortable using technology to manage their healthcare needs. I would say that, look, since we've been doing Phreesia a really long time, that number has just moved to, it's now that's the vast majority of Americans. They're just comfortable using tech. And I think if you ask most folks even 5 years ago, I don't think the number would have been over 50%. So I think on a high level, that was really, really important. I think the other thing that came out is, and I said this when I first saw, I remember reading the report, the things that popped out at me is they really value their provider and they value clinician time, right? So I looked at the virtual visit information as, yeah, they want to keep talking to docs. They want to meet with their nurse practitioners. They want to engage with them. Things I saw is they want to take on the administrative tasks. They want to book their own appointments. They want to pay their own bills without talking to people. They want to check in themselves. They're really saying, let us handle the administrative stuff and give me more face time and more clinician time where possible, which I think is the goal of every organization. So it's really nice that the North Star of what patients want and what we hear providers want is fairly well aligned.
It's so interesting, Chaim, that I was just talking to somebody yesterday about this and consumerism in healthcare. And I think you're right on. That experience we have in so many other industries of handling those administrative tasks, that's second nature to us as patients and consumers now. A good example is the travel industry. I can go onto my Delta app and I can book my appointment for the seat that I want, the time that I want to fly. And I don't expect my pilot to go and do any of those things for me. I'll take those administrative tasks on myself. And I'm much more likely to make my flight, to be there on time, and to have a great experience through that whole process. And I'm not saying it's as simple in the healthcare world as first class, Comfort Plus, or normal seats. It's much more complex when you start to talk about specialties and referral management and all of the complexities that come with healthcare. But consumers are demanding this more and more. And I think we see that trend and we see it continuing over the next few years.
What was also really interesting to me is the unbelievably low portal usage across the board. 60% of patients either never use their portal or only use them no more than once a quarter, right? And so I think it's sort of like the realization that you can't mandate good consumerism. It really has to be, consumerism is really about bringing the right tools to the right people at the right time. So that was something I was also somewhat surprised about. I don't know if you guys agreed.
Yeah, totally. It's we saw that portal usage chart almost divided into thirds. You've got a third that are active users, probably your more common chronic patients, deeply connected to their provider. Another third, as you say, barely touching it once a quarter, and another third almost saying, hey, I never ever touch my portal. And so it was an interesting find, and it's clear that there has to be more. I like how you phrased it, Chaim. You can't mandate consumerism. You've really got to go where the patients are and meet them there. I want to go back to something you said about the high technology savviness that we discovered, the 86%. That jumped out to me as well. So often we hear that older patients don't know how to use technology. I think that's an argument of the past at this point. There's a good discussion we could have about patients that don't have access to technology, but we're really talking about those that have a smartphone, that are connecting. That ageism discussion is kind of fading, I feel.
I couldn't agree more with you that yes, we have to be hyper aware of a society of the people that don't have access to those tools in specific socioeconomic categories that don't have smartphones or where language or reading are barriers. And that is a real thing, right? And I think we need to be hyper-focused about it. But we've seen technology adoption by folks over the age of 65 at a mass rate. And it might have been COVID, right? Like, the reality is, if you wanted to talk to your grandkids on a regular basis and you wanted to see them and you couldn't, you were using FaceTime at a certain point. Or you were using Zoom. And if you wanted to play bridge, you were using Zoom with your friends. And so some of it might have been that, where, necessity breeds usage, but some of it might have been what we've seen for years, which is they were using it before the pandemic, right? It just had to be intuitive and do what they wanted it to do. And it had to be at their reading level, in their language. So something we've spent a lot of effort on is making our products available in just a plethora of languages, right? Because America is this amazing melting pot.
Right. Great point. Another thing you mentioned is the communication and how much patients are really starving for that. I think one of the stories we learned behind the numbers, we saw the same thing. Patients really want a collaborative relationship with their clinician, but you look at that chart of how often they're using communication tools, it's actually lower than what providers are offering. And the interpretation we've had is the communication offered is for the benefit of the provider almost. And here's an example. I may have used this on a previous episode, but my clinician reached out to me to confirm if I'm coming to the appointment, yes or no. And I had questions. I wanted to engage. I was asking about fasting. Can I drink water? Do I have to avoid water? Where's your address? I know you have a new location. And there was no communication there. It was just, hey, if you're not coming, we need to fill your appointment with somebody else. And so I think some of the story behind the numbers is let's pay attention to what patients are saying, help me have a collaborative relationship, and give me the type of tools that I need to deeply engage.
And be very specific that the tools are coming to you. So at least with that, you didn't have to log into a portal to confirm that you were coming.
True.
Right?
Yep.
It was
text.
Very convenient, right? It was easy for you to use. No different than, to use the Delta example. Delta just texts me to remind me of my flight, remind me of boarding. I remember a couple of years ago, you used to have to log into the app to see what was happening, and often it was just wrong, right? And what they realized is if you want people to use it, you have to make it hyper available in all their forms of communication, and frankly, sometimes over communicate, right? And realize that you could solve a lot for a lot of people and just make it better, right? So even if we tried to solve for the 14% that aren't comfortable using technology, we'd be building very different products than the 86% that are. And that's something that I think a lot of folks in healthcare have become more comfortable with, is that it might not be everything for everybody, but if you get the majority using it, it's a win, right? It's just a massive amount of success. The other thing that popped out at me is how many people will pick their provider in competitive locations over these tools. And I think in a lot of markets, providers are becoming hyper aware. What was it? It was like the 18 to 35 demographic, if I remember, where they were they were likely to switch a provider over this. I don't think most providers have thought through like how that could impact their business and seeing patients in competitive markets.
I think that's such a fascinating finding that you bring up there, Chaim, that this younger group, and you think about the dynamics, they're just graduating college, they're in a tough economic environment. And one of the things they brought up in particular outside of the norm was the desire to know what they needed to pay for their visit prior to choosing their doctor's location. How important is that? Even though price transparency solutions are mandated now, the level of real adoption and real insights for patients is not quite there, and it doesn't empower them to make a really educated and informed decision about their provider But I think in the future, as those tools are developed, it will be a differentiator for organizations and how they're selected.
Yeah, so I think what patients want is easy, they want convenient, they want flexible, and they want things patient-centric. Right? That's if you sort of highlight, but I would also say they want to engage with the clinician, right? Like, and I think to your point around if you have these tools and you want to know how much you pay, but like that's all great as long as you make the clinician available, right? And when we talk to clinicians, and we do that as a very we as an organization, we live for our clients, right, and making them successful. They became doctors to treat patients, right? And we don't think about them as our providers. We think about them as people that if they use our tools, they can have a better experience at their practice and their staff is happier and they get a phenomenal ROI. And that's sort of, as an organization, that's how we think of our business and building product. And we thought it was really important when we published this with you folks that people understand that, like, I think a lot of providers want to know what patients want.
It's a fascinating time, and you can just feel how healthcare is being modified and needs to modify further, actually. Well, Chaim, love the discussion here. Any other key learnings that jumped out to you that we haven't talked about so far?
Oof. Probably we're going to move towards a more convenient digital first personalized approach pretty quickly over the next couple of years. And I see one of the things internally here at Phreesia that we spend a lot of, to me, it's about activating patients, right? Because an activated patient is, based on all the research, a healthier patient. An activated patient is a lower cost patient. An activated patient is a better patient to treat, right? And so how do you activate those patients, get them more engaged, and understand who is activated and isn't? Because I actually think if you look at the research, there are clear tools like the patient activation measure where you can measure, is a patient activated, and how do you move them into that, move them from one level to the next, right? And so little things make big differences. I just think like what's coming out is we can and want to activate more patients as a society. And if we do it, it is just going to be the net effect on healthcare in America will be healthier patients at, frankly, what everyone hopes for, a better price, right?
Well, related to that, what I find interesting is so many providers we are interviewing right now are dealing with nursing shortages, and you think about what a more activated patient could do, help with that strain on resources. So I think it's all related, and so many of the current issues keep pointing back to make it easier for patients, and they'll come along. So.
Yeah, absolutely.
You know, Chaim, it's fun to talk about this. You just exude passion about the topic. What was it about this project that made you so passionate, made Phreesia so passionate about partnering together and getting this information out to the industry?
Well, so it's, internally there was a really big debate. We've always looked at this information, right? So to us, this is a little bit of our secret sauce. Like, we saw 100 million visits last year, right? And this is how we make decisions. And I think one of the realizations that we've been having is now that we are become a market leader and just a much larger organization over the last, 5 years, it's sort of behooves us to start making sure that we're educating the world as to what we know could make healthcare better. And by not doing that, we're shirking our responsibility, right? So we have huge internal priorities on talking about patient-reported outcomes, right? We have huge priorities about using information to better educate the market as to what is happening and is happening with patients, what patients are saying, what they know. And so we've really started to take those insights and make them consumable. And when we started thinking about what patients want in terms of technology, there was just no better partner, because we don't ever want to do this generally on our own, even though we do publish papers on consumerism and what's happening. We couldn't think of a better partner to talk about technology than our longstanding partner in KLAS, right? Because we think you would do a better job of getting this information out there as to and help educate, because it's really about what do providers have to tell them what their patients want. All they're going on was gut, right? When really there's underlying data, and we thought we couldn't think of a better partnership.
Well, we appreciate that. That's kind of you to say, and it's been a great project to work on together. Chaim, you've already shared some insights of what you'd recommend, but anything else you'd recommend to our listeners based on findings from the report?
I think the thing that does pop out at us, and we see this with all of our clients, is you don't have to try to solve everything at once. Little things make big differences. These are all low-hanging fruit that provide massive upside to your patient experience while delivering a phenomenal ROI. So my advice, and something we've seen from lots of our data, which is, try it. It should be really easy to try whatever you do. You should be able to see the results. You should be able to add more from it without continuously having to go out to market to find 6 other vendors for the same, for each one of these things. And I think that's something we've seen. So scale and breadth of offering. And I would also say, talk to lots of other, make sure that whoever you work with is putting you in touch with lots of their other clients, right? Because we think that's wildly important, and that they provide you with the data on what's happening and what your patients are saying, right? We live on the data spectrum. So whatever we do, we want to be able to provide reporting and analysis on, are people using it? What are they saying? Are they happy? What are the and to us, that's usage is aligned with activation. If they're not using your product, it doesn't matter that you did it.
Can I ask you that same question, Dan, as our lead analyst on this report? We did something a little different. We actually made suggestions based on the data in this report. And any of those stand out to you that you want to share with our listeners?
Yeah, so many good suggestions in there. I think, perhaps one that I came back to over and over again as we looked at the data is just simplify the experience for the patients. We live in a really complex world in healthcare, and I don't want to take that for granted in any way, but technology has come so far that I really think we have an opportunity to take a complex environment and make it really simple for the patients. And patients have also come a long way in their engagement with technology. So when you simplify that process, you get patients educated and engaged, activated in their care, I think you'll start to see strong health outcomes and clinical outcomes, and patient engagement no longer will just be the administrative things. You'll start to truly see some increased wellness in society.
Love that. Great insights. And I want to add something related to what Chaim shared earlier, the patient's desire to communicate more and more. And one question we asked was, how much have you used telehealth in the past year? What's your propensity to use it in the future? Virtual visits, et cetera. And a strong majority of those that had used it plan to continue using it. And another subset said, I haven't used it, but I'm willing to use it. So fits nicely with what Chaim's teaching us. And our advice was, get ready for that next wave. Be ready to make it easy for patients to experience that, related to what you said. So there's so much more we could do. And Chaim, can you go another 4 hours on this podcast? Is that okay? Can we?
Actually, probably this is how I spend most of my day, so I could probably spend way more than 4 hours on it. Because I feel like half of our executive sessions when we get together are like just continuous learnings that we see. And so look, I just think healthcare is just a really fun place to be. You get to make experiences better, you get to improve businesses, and you get to make people's lives better. And I agree. The more you engage them in the simple stuff, we've seen it. Some of the most interesting programs we've done have been because we had a client that was fully engaged on the financial and administrative tasks, and they came to us and they said, hey, can you help us with these social determinants of health? We did that, and we published this huge paper in the New England Journal of Medicine on it. And we were only in a position to do that because they had it, rolled us out for administrative and financial and very operational workflow. And next thing you know, we're rolling out social determinants of health questions. We built out just a plethora of patient-reported outcomes tools, which just make outcomes better. They make the clinician experience better. They make patients feel more engaged because they're able to answer questions appropriately. And I just agree. If you start with the simple stuff and you earn the right to do the more complicated stuff, and the more complicated stuff is complicated for a reason. But it's really rewarding. And I feel lucky that I get to work with all the folks here at Phreesia. And frankly, we're lucky to have you folks as partners to publish this report. And we look forward to doing other reports with you guys in the future. The voice of the patient matters.
Well, thank you. The feeling's mutual. Your team made this report possible with the access to those patients, and it's a shared passion. This is something that's not going away, and it's very clear that organizations are listening, that we need to pay attention to what patients need more. So, well, Chaim, absolutely appreciate your leadership and partnership. Thank you so much. Great insights today. We look forward to staying in touch and helping amplify the voice of the patient more. So thanks for what you're doing.
Thank you. You guys keep it going. Hopefully I'll see all of you soon enough in person.
Sounds great. That's great. Thanks, Chaim. So glad Chaim could join us today, Dan. That was a fun conversation.
Yeah, this project has been many months in the making, and it's really fun to finally see the fruition of it. And we were talking with Chaim prior to beginning the episode just about how often we're using this data. And it seems like almost every day we're getting to share the voice of the patient, but not just the voice of the patient, the voice of many, many patients. And this study was 13,000 patients across almost every state in the U.S. and a lot of different demographics. And I just think the insights are fascinating, and we would encourage anybody to go really deep in this data and go check out the report because there's so much value in there.
Yeah, you and I both have commented this is one of the most rewarding projects we've been on. You've been at KLAS for 16, 17 years, and I've been here 10 years, and you just feel the energy behind it, that it's something that can really move the needle in healthcare if we really listen to patients more. I shared this with you. We presented some of these findings at the KLAS International Symposium beginning of June in Portugal, and we had a provider reach out and say, every once in a while, KLAS has a bit of jaw-dropping research, and that's what happened on your patient voice report. And man, goosebumps. That was really fun to hear that. And we had several providers come up at that event and others and say, we have to do this. We have to listen to our patients. And so I want to thank you. We're not finishing today's episode, but I want to thank you, Dan, for your passion and hard work on this. I know you spent many a late night making this possible. And so thank you. And we have to thank our other classmates. This was a team effort for sure.
Yeah, I appreciate it. This is such a fun project to work on.
And we've already thanked Phreesia, but thanks again to them for partnering on it. Just want to share a couple nuggets that jumped out from the discussion with Chaim. When he talked about activating patients and how important that is, that can lower costs, that can make it easier, improve the experience. My mind went to the quadruple aim, and to me that is why engaging patients in their care and the burst of technologies we've seen the past several years even exists today, that quadruple aim. So that really jumped out to me.
I love that term that he used too, because it's so much more than just engaging or pushing messages to patients. The term activation I love because it involves almost this two-way relationship. The patients are engaged in a way that causes action. And I agree that we'll see outcomes as we activate more patients in their care.
Great point. The other thing I really liked is when he recommended that organizations don't have to solve everything at once. And I think often there's that feeling of, well, if I can't make everything better, it's just going to have to wait. But what if you just made scheduling better? What if you just made communication better? Do one thing that makes a patient feel heard and feel engaged. I really like that approach. It's one bite at a time to eat the elephant, right? You have to just start somewhere and go anywhere. So I like that advice.
I think that's really helpful advice as well as you consider the many priorities healthcare organizations have right now. You've got staff burnout, you've got operational challenges, you've got patient-facing technologies, you want to attract and acquire patients. But I really believe if you do this the right way, it doesn't have to be an either-or conversation. It can be an and. If you're engaging patients the right way, it's going to reduce your administrative burden. It may free up your clinicians to be doing the things and practicing at the top of their license. So I think there's a lot of opportunity in the healthcare industry right now.
That's a key point. You don't have to say, well, we have to do everything the patient wants or everything the clinician wants. There's a medium in there. Include the patients, bring them along. Right. So great point. Okay, can we switch for a moment and talk about some things we're hearing out there that are related to our focus and podcast?
Yeah, you were telling me you had something that you'd been hearing recently. I'd love to hear it.
So I was in a meeting with a vendor partner, and they talked about a health system that was trying to address staffing shortages, and they came up with a really creative way. I thought about our listeners and today's episode to share that. Basically, in the interactive patient system space, it requires some training. This is the devices that have education and entertainment and so many other pieces that help patients in an inpatient setting typically. And to reduce some of the staffing shortages, they have asked volunteers to actually train the patients on these technologies, or pre-med students. You think of a pre-med student trying to get hours in the hospital, face time in front of the patients. And what a creative, synergistic way to say, hey, let's make sure these technologies are meaningful to the patient and taking advantage of some of those resources that are there. And so I thought that was a really creative approach.
Yeah, that's fascinating, because I've had many of those conversations in the past with these types of solutions, and you hear often, well, the nurses have to go in and start the educational materials, or they have to help them navigate it. And we hear probably on a daily, if not weekly basis, just the challenges in healthcare right now. The pandemic has really put a burden, especially on nurses. Yeah. And there's a shortage. They're feeling burned out, and anything we can do to take pressure off their plates, I think, is a win.
I agree. Yeah, I thought that was really creative. Okay, I've got a quote for you, Dan, for today's episode about listening and multitasking. Okay, so this is from the author of the book, The Road Less Traveled, M. Scott Peck. He said, "You cannot truly listen to anyone and do anything else at the same time." And I'm sure my wife would make me pay attention to that quote. Do not multitask. Make sure you listen. Shout out to Janet Charrington. Hello. And isn't that critical in healthcare? Let's focus and deliberately listen, especially to the patient. That's what we're all about here. So.
Yeah. Well, thank you for sharing that. That's interesting.
You bet.
Well, once again, we want to thank our guest, Chaim Indig, today, and really appreciate the insights he shared and the conversation around focusing on the patient and what we can do with technology. Adam, as always, it's been a pleasure to do this podcast together, and we look forward to being with you on our next episode.
Thanks for listening.